How many of you smoke cigarettes? Okay. Well, how many of you know a smoker? Okay. But, well, I have an example, a quick example. My grandfather died of cancer from smoking. He had a bladder cancer, and he only died when he was 63, pretty kind of young. I really didn't get to know him real good or anything. I was only 4 when he died. But also, I have another example that my uncle, he has lung cancer because he smokes, and he still doesn't stop. So hopefully you could tell your smoker friends to stop smoking after I give you some statistics. You may wonder what our future generation may look like because of the effects of smoking. According to a study of teen smokers, young men who smoke may be both compromising their fertility and increasing their risk of fathering a child with genetic abnormalities due to sperm mutations in smokers. Males who smoke have cough reflex that is slower to react than non-smoker males. The person's reflex to cough is a defense that prevents foreign material from entering from the respiratory tract and helps mucus from the airways. Women who smoke may also have reduced fertility. One study that found 38% of non-smoker women conceived in their first cycle compared to 28% of smokers. Smokers were 3.4 times more likely than non-smokers to have taken more than a year to conceive. As young adults, we should try our best to stop people from smoking to prevent an increase in diseases and deaths. In the United States, cigarette smoking is the leading cause of preventable morbidity and mortality, and results of approximately 430,000 deaths each year. There are many harmful ingredients in cigarettes. One of them is ammonia. Scientists have discovered that ammonia helps you absorb more nicotine and keeping you hooked on smoking. And it is a drug in tobacco that makes smoking powerful, more addiction. A second one is arsenic. It's a poison. And this is a deadly poison that makes your lips burn and gives you bad breath. A third ingredient is benzene. This is the cancer-causing chemicals that uses to make everything from pesticides to detergent to gasoline. And cadmium causes damage to the liver, kidneys, brains, and stays in your body for years. Lead, and that's also a poison for us. Stunts your growth, it makes you vomit and damages your brain. Tobacco leaves long-term effects such as death, heart disease, cancer, lung disease, reproductive damage, and birth defects. Tobacco kills more people through heart disease and stroke than it does through cancer. There are many different types of heart disease: hypertension, or also known as high blood pressure, congestive heart failure, which is ineffective pumping of the heart that leads to accumulation of fluid in the lungs, coronary heart disease, which is narrowed arteries that lead to heart attack and death, and heart attacks and congestive heart failure. There are many different types of cancers involving smoking, like lung cancer. Also, you could get that really just regular smoking cigarettes. Upper respiratory tract, which is also inhaling smoke, and larynx cancer, which is also from smoking or also chewing tobacco. The mouth, the throat, the stomach, pancreas, kidney, and the bladder. And you could get cervical cancer from smoking, but that's mostly women chew tobacco, but it's very low percentage. One may also develop lung disease, also known as emphysema, when the very small airways that join tiny air sacs in the lungs lose elasticity. Patients lose ability to excel fully, and chemical balance in the blood is disturbed. There is no cure for emphysema, so really you'll be, that way the rest of your life, always breathing heavily and wheezing, coughing. And you have chronic bronchitis. That's another illness you can get from smoking. The airways of the lungs change the shape, and the size of the mucus glands are enlarged, causing the coughing and production of sputum, which is in your mucus for breathing. Reproductive damage. You don't really think that reproductive damage might happen through smoking, but it does. Abnormal sperm cells and impotence, difficulty maintaining pregnancy, and menstrual disorders and early menopause. Also, when you smoke during pregnancy, there's birth defects. Smoking during pregnancy can lead to miscarriage and stillbirth. And if you do have a baby, the probability of the baby being in low weight is a possibility. Babies born to mothers who smoke during pregnancy weigh an average between 200 to 300 grams less than other babies, and also premature birth. Both low weight and premature can lead to breathing and other health problems to the infant. Learning and behavior problems later in childhood. There could also be sudden infant death, or also known as crib death. More upper respiratory problems and ear complications and asthma when exposed to tobacco prior to birth. Other damages that tobacco may leave on a person is wrinkled skin, permanent gum and tooth loss, and loss of weakened sense and a weakened immune system. You get stomach ulcers and unwanted weight loss. Cigarette smoking is associated with increased incidence of prenatal disease and poor response of prenatal therapy. Clearly, the use of tobacco only negative effects to your health. Make sure that you do not persuade to smoke or chew tobacco because of appealing advertisements and peer pressure. There's a lot of your friends are doing it, and you want to look cool, and you're like, oh, I'm going to smoke a cigarette because it's the grown-up thing or whatever. People have been smoking tobacco for centuries, and people think that tobacco was a good medicine for them, but it's really not. It's really, really bad. And people used to smoke because of mood alternating abilities. Teens are far more likely than adults to favor a ban forbidding the sale of tobacco products throughout the nation. 62% of teens support the national tobacco ban, whereas 14 of the adults do. And support for a national ban is far weaker among smokers, but the majority of 58% would support a law prohibiting sales to the under age of 18. Young people begin to smoke because of social pressure, curiosity, and desire to feel grown up. But pharmacologically, tobacco acts like a heroin in hooking its victims. Would banning cigarettes and their advertisement prevent an increase in health problems? A Health and Safety Commission study says up to 2,340 lives a year could be saved by outlawing workplace of smoking. And the study says such a ban would prevent to 180 lung cancer deaths a year, with further 866 people expected to avoid diseases and stroke, bronchitis, and asthma, as well would be fewer workplace injuries and fires, just cutting back on smoking. As an event, banning cigarettes would greatly decrease cancer rates. As challenging as it may seem, there would be a way to decrease the temptation of smoking. The BBC World Service lists many ways to resist smoking. And there could be, go and keep your hands busy, or if you, use a nicotine patch, exercise, don't try to keep with people who smoke around you, and wash, do chores around